Assalamu alaikum. A 1-month-old boy came to the ED by his mother with the problems of vomiting and fuzziness. This baby, before 3 days ago, he started vomiting, and vomitus was not actually bloody or bilious. Mother thought that it may be due to GRD, so she did not take it very seriously. When this baby came to the hospital, there is intermittent bradycardia and hypertension. Bulge. Anterofontanale is bulge. Anterofontanale is bulge. And when we have done this MRI, there is a presence of these hydrocephalus in these newborn. And when we done the eye examination, there is downward gauge bilaterally. So what should be your differential? My first differential, it may be due to Vkbd. That means vitamin K deficiency bleeding, causing this intracranial hemorrhage. This is the hyper intense area. This is hyper intense area, which looks like there is a bleeding. And we know that vitamin K is an essential coagulation factor for 27910, and deficiency increases the risk of spontaneous bleeding. Newborn with vitamin K deficiency due to poor placental transfer, absence of blood flora to synthesize these vitamin D, and immature liver function. Therefore, intramuscular vitamin K is administered at birth to prevent bleeding. Patients who do not receive vitamin K, patients who do not receive vitamin K are increased risk of vitamin K deficiency bleeding, particularly if exclusively breastfed because breast milk has insufficient vitamin K. We know that breast milk has insufficient vitamin K, and woman and gut flora is sterile. Neonatal gut flora is sterile, unable to synthesize vitamin K. That is the reason of vitamin K deficiency bleeding. And classic vitamin K deficiency bleeding presents with first week of life with easy bruising and mucosal and GI bleeding. Late onset vitamin K deficiency bleeding occurs between 2 weeks to 6 months with intracranial hemorrhage. This sort of usually it happens after 2 weeks and after between the 2 weeks and 6 months. As seen, these patients in the form of obstructive hydrocephalus. These hemorrhage can block the CSF fluid outflow and can leading to obstructive hydrocephalus. This is seen in this patient. And as there is raised ICP, so there is irritability, vomiting, bradycardia, hypertension. Infant with hydrocephalus typically have bulging frontally, rapidly enlarging head circumference, may also uh, pressure on the midbrain may also cause upward gaze impairment. And that is all about the VKBD, vitamin K deficiency bleeding. Hope you enjoyed.